if she has to cut out a little bit earlier, she'd be leading this because she's literally been, our point person amongst all the Democrats on this issue. And I also want to give a shout out to Senator Klobuchar and her staff. This is how she helps organize all of these events. Now, literally for months and months, we've been saying to our Republican friends, we got a crisis coming. It's going to hit at the end of the year. 22 million Americans use these tax credits to get health care that makes it affordable. And unfortunately, we've kind of got a kick the can approach from them repeatedly. And it's kind of mind-boggling to me. I know I'm going to hear from Kathleen, who shared her story, and I'm sure all of you will, and the same thing happening in New Hampshire, where people that may have been paying, $500, $600 a month, they're suddenly looking at $1,200, $1,500, $1,700. The idea that somebody that's kind of, middle income is going to have to pay an extra $1,000 a month. And the cruelty of this is we've been talking about it, but it really is driving home, since many folks make their decision, during the middle of December. It's not real until you see the rates. The rates are out there. How many Christmases are going to be ruined when suddenly people realize, oh my gosh, we can't afford health care going into the new year. And the idea that, our Republican friends, are still trying to, 24 hours before the vote, scheme and scam about what their alternative is. I'd be the first to acknowledge, the ACA is not perfect. We need a better overall healthcare system in America. But the idea that we're going to take one of the legs of our healthcare system and kick it aside without anything to replace it is, I believe, downright cruel. And the truth is, as we kick this into January and say, oh, we can fix it next year. Well, what do we do with all the people who've either opted out or who have bought those higher premiums? Are they going to, it would be a chaotic mess. So I want to just, I also heard from a couple of other folks that I think we may hear from. One gentleman, Ron, had a major surgery, $2.1 million. He could have never afforded it. ACA tax credit saved his life. And I think that was on the call, Kathleen, that we were doing. So we got to get this fixed. I'm going to turn it over to Senator Shaheen. We are going to be joined. This is, for those of you anybody here, this is your first hearing? Anybody here in the room, your first hearing? Okay. Anybody in the crowd, their first hearing? This young man, is your first hearing? Well, this is going to be a little bit kind of ad hoc because so many of my spontaneous. So many of our Democratic colleagues are going to be coming in and out. So I'm going to turn over to Senator Shaheen. I'm going to ask my friend Peter Welch to make a couple opening comments. We're going to introduce you all and just kind of roll with it. And we were going to bring this issue to light. So turn it over to Senator Shaheen.
Well, thank you, Senator Warren, and thank you.
My name is Senator Warner.
I'm sorry.
It's all right. You're a good person.
Hassan. I'm Senator Hassan. Senator Warner, thank you for co-hosting this event, and thank you to all of our witnesses today for being here. We're really pleased, and to all of the audience members for joining us. As Senator Warner explained, the way this will work, and we're really here to hear from each of you about your experience and why you see these tax credits as being so important, and what it's going to mean to our healthcare system if those credits are no longer available to people to help them pay the cost of health insurance. So I have a long statement here that I'm going to introduce for the record, but because we really want to hear from each of you, I want to stop with this and we'll ask Peter to give a few opening remarks and then really hear what you all have to say about why this is critical.
And the great thing about Senator Welch is he has served in the House with distinction for many years, so he knows about the House 2-minute rule. So we're going to turn it over to
Senator Bigfoot over here telling me to shut up, but that's good advice because we want to hear from you. But we have to extend these credits. I mean, it's very simple. healthcare costs are brutal. We have to have a comprehensive change in our healthcare system. It's broken. And we can play the blame game, which is a popular sport around here between Republicans and Democrats. But for the impact of what happens to families who are depending on those healthcare tax credits, we can't blame them. We can't blame them. They have no ability to affect what the insurance premiums are. They have no individual ability to affect the soaring cost of healthcare. And the cruelty of inaction, where we're the one body in the United States that can provide fairness so that folks who have health care in 2025 don't lose it in 2026. It's absolutely inexcusable for the United States Senate not to act to protect. And that discussion, which I'm all in on, to bring down health care costs, they're unsustainable, we'll have that. But we can't do it by starting out by just punishing American families. So thank you very much, Senator Shaheen and Senator Warner, for this.
Thank you, Senator Welch. What we're going to do is I'm going to
2 minutes.
introduce each
That was
of-
2 minutes.
That was you. I'm going to introduce each of you. You'll make your statements, and then, as senators come in and out, questions. I think we'll reserve all the questions till everybody gets their statements out. First, we're going to hear from Katie Keith, who is the founding director of the Center for Health Policy and Law at the O'Neill Institute at Georgetown. She also serves as the O'Neill Institute's first ever Director of National Affairs and Programs and is a lead contributor for Health Policy at Crossroads, a series for the American Health Affairs Forefront. From 2022 to 2025, Ms. Keith has been on public service leave from the Institute, during that period serving as Deputy Assistant to the President and Deputy Director of the first ever White House Gender Policy Council. Ms. Keith received her JD from Georgetown, her master's degree from Johns Hopkins, and her BA from the University of Texas. Ms. Keith.
Thank you so much, Senator Warner, and thank you for the opportunity to testify today on the urgent healthcare affordability crisis that you've already spoken to if Congress fails to extend these enhanced premium tax credits. In just 3 short weeks, 22 million people will face skyrocketing premiums that will become a reality for those 22 million people. I'm here today to discuss the progress we've already made under the Affordable Care Act to date and the devastating consequences that will occur if these tax credits are not extended. So the ACA has resulted in historic coverage gains and a record low uninsured rate. The law's coverage expansions have improved families' financial stability, have narrowed disparities, and have increased food and housing insecurity for millions of people. And millions more, including those with job-based coverage, have benefited from the law's consumer protections, from the requirement to cover pre-existing health conditions, to preventive services, to the law's ban on dollar caps on care. The enhanced premium tax credits have helped even more low and middle income families access affordable, high-quality health insurance through the marketplaces. For the first time, many middle income people were able to access these premium tax credits, and the premium tax credits were increased for lower income people. Overall, these enhanced premium tax credits ensure that no person who buys their own health insurance pays more than 8.5% of their overall income towards premiums alone. These enhanced tax credits have led to significant coverage gains. We've seen marketplace enrollment double from less than 12 million people in 2020 to more than 24 million people for 2025, with the biggest enrollment gains seen in states like Georgia, Louisiana, Tennessee, and Texas. And marketplace enrollees have seen significant savings. So in 2023, nearly 15 million people saved $800 in premiums on average, thanks to these enhancements. Without an extension, millions of consumers will face higher net premiums, which will more than double on average. Those that can't afford these higher premiums will face extremely difficult decisions. Some will choose to go without health insurance at all, and they'll be left unable to afford the health care that they need. Others will face higher deductibles because they'll opt for a less generous plan with a lower premium. And still others might head to non-ACA plans that don't cover pre-existing conditions or comply with other ACA standards, often with devastating financial consequences that consumers learn of only too late. In each one of these scenarios, consumers would face much higher healthcare costs. And that's not all. The loss of enhanced premium tax credits will also impact non-marketplace enrollees too. We'll see higher premiums for those that get their coverage outside of the marketplace. We'll see job losses, lower state and local tax revenue, and lower rural hospital revenue as well. With the 2026 open enrollment period now in full swing, millions of Marketplace enrollees, whether they're entrepreneurs or small business owners or caregivers or farmers, are all facing the premium shock at a time when many can barely afford the high cost of living that we're seeing all across the country. As you all know very well, this is a crucial week to prevent these devastating premium hikes in January. Congress can and should avert this looming affordability disaster by extending the enhanced premium tax credits for 2026 and beyond. So thank you for the opportunity, and I look forward to your questions.
Thank you. And I just quickly, the obvious, the states where the biggest increase are Republican-controlled states that never expanded Medicaid. Again, folks, so I hope will realize. Next up, I'm excited to introduce Ms. Kathleen Winters, who is from the Commonwealth of Virginia, who I had the opportunity to at least visit with on the phone a few weeks back. Ms. Winters is founder and owner of Birth and Milk, a small business provider of birth lactation support throughout Virginia. Ms. Winters is a certified birth doula and has been working in the prenatal support field since July 2020. Frankly, as you told me, you started this business having experience through your own personal experiences. She lives in Newport News with her husband and 2 kids, her health care premiums are set to increase, and get this one, from $544 a month to over $1,500 a month. Says it all. Kathleen?
Let me just recognize Senator Klobuchar, who came in.
Thank you. Thanks for all your work. Thanks so much. Good afternoon, and thank you for the opportunity to share my story. My name is Kathleen Winters. I'm a birth doula and board-certified lactation consultant, and I run a small independent practice in Newport News, Virginia. My husband is an adjunct professor who also runs a small editing and translation business. Neither of us has access to employer-sponsored health care. Prior to 2020, we were in graduate school preparing for full-time tenure-track careers in academia. With the onset of the COVID-19 pandemic and the subsequent wave of hiring freezes at universities across the country, we began to reconsider our career directions and plans for postgraduate employment. Due to the Affordable Care Act, my husband and I felt empowered to consider career options that were not directly tied to employer-sponsored health insurance plans. Following the birth of our second child, we moved home to Virginia and took the risk of starting our own businesses. Thanks to the Affordable Care Act coverage and the Medicaid expansion that Virginia had recently enacted, we felt confident that doing so would not jeopardize healthcare access for us or our young children. Since 2022, our businesses have grown steadily, and we no longer qualify for Medicaid coverage. For the past 3 years, we've purchased health insurance on the Virginia marketplace and have received the enhanced premium tax credits. During our first year of ACA coverage, our premium was $0 a month, which helps us considerably as we work to get our businesses off the ground. I have several health conditions that require regular lab work and visits to specialists multiple times per year. Our sons also have health conditions that require regular visits to specialist providers and have included hospitalizations and multiple ER visits. Because of this, we opted for a healthcare plan with a low deductible, which comes with a higher but more predictable monthly cost. The enhanced premium tax credits have made this plan manageable for our family budget. In 2025, we paid $544 a month for a plan that covered all of our doctors and had a low deductible and copay. In 2026, our premium for that same plan is slated to be $842 a month, or $300 more. If the income cap that was lifted in 2021 is reinstated, which I understand is likely to happen, I'm concerned about what will happen as our businesses continue to grow. Currently, our income hovers near 400% of the federal poverty limit. Without that subsidy, the 2026 premium for our current plan would be $1,552 a month, or $18,624 for the year, which we simply cannot afford. The escalating cost of healthcare for hardworking Americans is bad enough by itself, but Congress's inability to settle on a solution has worsened the situation by making uncertainty the norm. We would love to see a resolution, but at the same time, we're honestly scared to see what that resolution will be. With small business owners like us continuing to receive much needed support, or will we wake up one day to healthcare costs that are now triple what they are today? The Affordable Care Act is not about giving handouts, it's about helping working families. I often hear politicians say that small businesses are the backbone of the American economy. Starting a business is challenging under the best of circumstances, and there are many barriers to doing so. In the United States of America, access to affordable health care should not prevent anyone from starting a business, changing careers, or being able to live the life of their choosing.
Well, thank you, Kathleen. And yet, 4 of us up here who doesn't want to make that happen, and a bunch of others.
We appreciate your work.
Next, I'm honored to introduce Ms. Audrey Gastier.
Gastier.
Right? Great. Since 2003, Ms. Gastier has served as the Executive Director of the Massachusetts Health Connector, the state's official ACA health insurance marketplace. Prior to her appointment as Executive Director, she served as the Health Connector's Executive Director and Chief of Policy and Strategy, as well as a number of other roles at the marketplace since 2012. She's also served as Director of Health System Policy at Massachusetts Division of Healthcare Finance and Policy. Ms. Gastier is an instructor at Harvard T.H. Chan School of Public Health, where she also received an MS in Health Policy Management. She holds a BA from Mount Holyoke. Thank you for being here.
Thank you so much for having me. Thank you for the opportunity today to detail the impact of not extending enhanced premium tax credits, or EPTCs, on the health and financial security of people across Massachusetts and the United States. My name is Audrey Morse-Gastier, the Executive Director of the Health Connector, Massachusetts' health insurance marketplace. I am here to highlight what I am seeing in Massachusetts as the harms of inaction bear down on hundreds of thousands of residents. But please know that the fear, worry, and instability caused by this impasse are mirror those rippling through the lives of the 22 million Americans in EPTC-supported marketplace coverage across all 50 states. EPTCs have brought into reach health coverage that serves as a lifeline, providing access to essential benefits like life-saving cancer screenings, medications to manage chronic conditions, so people can work and remain productive and well. It has meant greater stability for our insurance markets and provider systems. For the millions of Americans losing EPTC, this issue is not a remote political debate. It is a gut punch to those working to make ends meet and trying to maintain their health and their financial security. And this gut punch is not some future abstraction. It is here. Because of the expiration, over 330,000 of the people we serve in Massachusetts are now seeing premium spikes like nothing we've seen in the Affordable Care Act era. The impact for those hardest hit, it can go one of two ways. It can mean painful trade-offs to stay covered. We hear from enrollees who work full-time that they are having to pick up second part-time jobs, and from young parents who have decided to put off trying for a second child. Or it's the decision to roll the dice and go without coverage. Already this open enrollment, over 10,000 of our current enrollees have terminated their 2026 coverage. That's double the number of terminations from this time last year. These lose-lose choices mean that our call center and our navigators are guiding people through panic and fear. Enrollees with complex medical conditions are in shock, scared they won't survive without the care their coverage enables, yet will simply be unable to make the math work. Our call center has even seen an increase in callers expressing intent to self-harm. A forthcoming increase in uninsurance will also weaken our whole healthcare ecosystem, destabilizing our essential providers and our insurance market risk pools, already made more fragile by cuts in the so-called One Big Beautiful Bill Act. Massachusetts hospitals and
We don't call it that.
I said so-called. Massachusetts hospitals and community health centers will have to shoulder more uncompensated care. Uninsured people who forego care will later end up at their doors sicker, further straining caregivers and capacity. As a country, we will all pay for these increased costs and bear the risks of a delivery system on shakier ground. When the Senate votes tomorrow on whether to extend EPTCs, the stakes could not be higher. From what I've witnessed in the first weeks of an open enrollment without EPTCs in play, I can tell you that the health and security of millions of Americans and the stability of our fragile healthcare systems are on the line. We do not have to go backwards like this. I implore the Senate to stand up for Americans whose healthcare hangs in the balance and for our healthcare systems that simply can't take another blow. Thank you again for this opportunity, and I look forward to your questions.
Pretty stunning numbers of already. Our next guest is Ms. Kendra Bush, who is traveled from Portage, Indiana. Ms. Bush works 2 jobs providing home care for people with serious health conditions. Often, I understand, dealing with folks who just got discharged from the hospital.
Absolutely.
Through her work, she's seen how unaffordability and other barriers to care keep people away from health care. Ms. Bush's premium is currently set to skyrocket from $20 a month to about $400 a month.
Yes.
Wow. And And that's for the lowest cost plans, with some of the plans looking at, I understand, go as high as $900 a month.
Yes.
So, Ms. Bush, thank you for being here. Anxious to hear your story.
Thank you, too. Good afternoon. Thank you for inviting me here today. My name is Kendra Bush. I am a home care provider from Portage, Indiana. I started working in home care because I love helping others. My patients rely on me after they get out of the hospital. I help them do tasks so many of us take for granted, like walking, eating. Just on Monday, my client was so happy to be able to shower for the first time in 2 months. This job is rewarding. I make a difference in this world, but it is also difficult. Home care workers are important but underpaid. I work 3 part-time jobs, but I still don't take home the same pay each month. Home care isn't a field that includes guaranteed hours or benefits. I get my health insurance through the ACA marketplace. Imagine how I felt when I learned my monthly premium is set to jump from $20 to $400 because of the tax credits are expiring. And that is $400 for the lowest cost plan, but I may have to pay more. Some of the plans are going up to $900 or more. I am angry because healthcare costs are going up to help the billionaires. My clients are also hurt by these policies. Since October, I see their care hours reduced because of the Medicare cuts. Letting the ACA tax credit expire will make things worse. People often end up right back in the hospital without accessing to good health care. Today, I am urging the Congress to fight back for the ACA. I remember the bad old days before the Affordable Care Act. I grew up in the mill town, which Abasta, many of my loved ones died from cancer because they couldn't afford treatments. I enrolled in the Affordable Care Act during President Obama's first term. It allowed me to get regular screening and treatments, my high blood pressure. The ACA helps the community people to take care of their health more. Not extending the Affordable Care Act tax credit sends us backwards. Every elective officer should be fighting for health care for all, not protecting billionaires. I want to end this with another personal story about my mom. She is 99 years old and is one of the healthiest people I know. She enjoys a full life. She shows me how having good health insurance and doctors on teams make things happen. I also have a person's health can decline with it. I should not be this way in the richest country in the world. As a home care worker, I want to do my part to make sure everyone enjoys a long life like my mom. Now, can you do your part? Please help me by extending the affordable tax credit. Thank you for hearing my story.
Thank you so much, Ms. Bush. And I'm going to now, since Ms. Stearns is from New Hampshire, Senator Shaheen, and then I think what we're going to do is then after she makes her comment, we'll start with our colleagues because they go in and out and they can ask first questions, and I'm here for the duration. So.
Well, I'm delighted that we are joined by Susan Stearns. She's the executive director of NAMI, New Hampshire, which is an organization that provides support, education, and advocacy for people affected by mental illness. I've worked with Susan over the years very often and value the tireless work that she's done in our state to address substance misuse and also our mental health crisis. She knows better than most how important health coverage and the ACA marketplace can be for people with mental illness. So, Susan, you also have a personal perspective that I think is important in addition to your role at NAMI. So we're delighted that you're here today. Thank you.
Thank you, Senator. It's a privilege to be here. For the record, I am Susan Stearns, Executive Director of NAMI New Hampshire. I am also blessed to be the mother of 2 brilliant adult children, one of whom lives with a serious mental illness. I do want to take a moment and address the fact that this is really hard for people to hear this, and I heard what Audrey had to say about hearing from people considering self-harm, and I want to remind people that 988, the crisis line, is available 24/7 for every American, and please make sure that you are reaching out for help. So my child was first diagnosed with an emotional disorder at age 5 and a serious mental illness by age 14. We were fortunate My employer's health insurance covered my child and the mental health treatment that kept him at home, in school, and not in an emergency department or residential treatment setting. As he grew up, I realized that his path would be different from that of other children because of his disability, that he might not always be able to work 40 hours a week and therefore might not have access to treatment. That terrified me. He had been a treatment success story, never hospitalized, but without insurance, he would lose access to care, likely decompensate, and face hospitalization or even homelessness. After several years of instability, he likely would be determined to be disabled. My child is not alone. 1 in 5 adults and 1 in 6 children lives with a mental health disorder. I know I am not the only mother to fear for the future. Then the ACA became law, and in 2014, New Hampshire expanded Medicaid. As my child's 26th birthday approached, he applied for coverage. I wept when his application was approved. Since then, he's had periods of full-time work with employer coverage, part-time jobs where he has purchased ACA marketplace plans affordable only because of subsidies, and times when he has needed to utilize Medicaid expansion. This flexibility has allowed him to work and live as independently as possible. In New Hampshire, we are working to strengthen our fragile community mental health system so that care is available to people when and where they need it. Providers, FQHCs, community mental health centers, and critical access hospitals warn that the loss of enhanced premium tax credits could force closures of essential programs and facilities, reducing access to care. Thanks largely to increased treatment access made possible through the ACA, our state has finally started to see overdose deaths decline. Nearly everyone in New Hampshire knows someone who has lost a loved one to an overdose. I know many people, unfortunately. Recovery isn't linear. People often move between Medicaid expansion and subsidized marketplace coverage. This fluidity is literally life-saving. In my role at NAMI New Hampshire, I hear about the impact on granite staters from the expiration of the enhanced premium tax credits. Caregivers facing premiums that are twice or even 5 times as high as last year. Nonprofit employees making impossible choices whether to forego coverage or seek other employment. Many of my fellow NAMI leaders from across the country report the same struggles. Nonprofits are often the final bulwark between our most vulnerable citizens and catastrophe. The expiration of the enhanced premium tax credits threatens the very sector that safeguards our communities. Making healthcare coverage even more out of reach for so many of us will threaten the progress we've seen on overdose deaths and mental health access, further straining our community resources and nonprofits, and threatening the very well-being of people across our communities. I urge you and your colleagues, protect our healthcare to protect our communities. Well, thank you.
Thank you all, and I think, again, maybe even, as Keith said, like, this is not policy. This is policy, but it's also personal human lives. And Senator Klobuchar is the kind of mother of all of the spotlight hearings. And so I'm not sure I know the full protocol, but I thought we would go to, Senator Welch or Senator Klobuchar, then Senator Hassan, and I know you've got to leave at 12:40. I'm here for the duration, so what's the protocol of who wants to go next?
If you want to go first, you were here earlier. Good. Go.
All right. First of all, I don't have many questions because you were so clear. It's a catastrophe. And everything from you're dependent on it to the flexibility, the option to make a choice about having another child, everything that should be automatically available to life for our citizens is compromised. I do want to talk a little bit about what the so-called plan is that's being offered by the Republicans. Because I was saying earlier, we want to get to yes on this. And Senator Shaheen, you and others We're very engaged in trying to talk to Republicans to see if we get some way to do that. But their current plan is this $1,500 HSA. And I just want to go through what that means to a Vermont farmer who called me, and I speak about him a lot. He's got a good plan right now, and he pays about $900 a month. His premiums will go up to $3,200 a month. Under the Republican plan, he'd have to lower the coverage to a bronze plan. His premium would be $1,695 a month. His annual deductible is $6,000. His out-of-pocket limit is $10,600. So under that plan for him, real world, is if he has a really good year, doesn't get sick, it's $21,000. If it's a bad year, somebody gets sick in the family, it's $35,500. The plan that is being offered by our colleagues would give that farmer and his family $1,500. Do I have anything wrong in concluding that the math doesn't work there? I mean, let's just go down. Does the HSA plan, $1,500, in any meaningful way help as a substitute for the tax credits? I'll just have each of you speak, and then I'll stop.
A resounding no from me.
You know?
I have a hard time comprehending it because it's a crass word, but it's stupid. It's, I mean.
That's not a crash.
$1,500, I would love to say other ones, but $1,500, I mean, not
That's
a
what
month,
it is.
a year. I'm speechless. I am terrified.
Yeah, it's wholly inadequate, and I would just say that level of exposure to cost sharing and the variability of healthcare costs, most people cannot afford that, and it really amounts to a surcharge on people with pre-existing conditions, because to the extent that they need to access more healthcare to maintain their health, or God forbid somebody has an unanticipated accident or illness, nobody plans to get sick, but that is exposing them to really dangerous levels of debt and foregone care.
I say a no, because I can't see no one paying that kind of money.
What do you think your mom would say?
Oh, she really would say something bad. I can't repeat her.
Senator, I was an English major, but I do seem to see your point about the math not working. I will mention that I happened yesterday to be at the New Hampshire Behavioral Health Summit and met a provider who is duly licensed to provide mental health and substance use disorder treatment. Did not tell him I was coming here, and he told me, in talking about his concerns about our behavioral health system, that he had patients who were facing premiums that were 4 times as high as for next year than this, and looking at plans where they were going to have to start rationing their care. So they were making plans for how they would reduce their treatment in the coming year.
That's amazing. Well, thank you. And the argument that my colleagues who are advancing this plan make is that this $1,500 goes into your pocket instead of the insurance company pocket. But it looks like an awful lot more money comes out of your other pocket. But thank you all very much.
Can I make a quick point on that? So as a birth doula and lactation consultant, it's just me. A small business is a silly term. I'm a micro business. I do all my own billing. I am not legally allowed to bill cash pay rates less than what I bill the insurance company. And I have to bill the insurance company 30% more than what their maximum payout is in order to get that maximum payout. So this idea that if you just give people money and they can go get better care with a cash pay is not accurate. I'm legally not allowed to give you a discount.
That's very helpful.
Well, thank you, everybody. And I know we're supposed to go, but do you have to leave at 1:45? I do. I'm not going to ever get Senator Klobuchar on the wrong side of me, but since Senator Shaheen was the co-host of this, we can let her do, and then we'll go to Senator Klobuchar, and then.
Okay. I will be brief, but again, thank you all very much for your testimony. Ms. Keith, you gave a great description of what would happen if the enhanced premium tax credits aren't extended. And as you all know, the vote is tomorrow, so it's going to be a critical day. But can you talk more specifically about who gets harmed the most. I know small business owners and their employees are really affected, but so are people 50 to 64 years old who aren't eligible yet for Medicare.
No, thank you for that critical question, Senator. So older adults, ages 50 to 64, will be disproportionately impacted if Congress fails to extend these enhanced premium tax credits. The reason for that is seniors have the highest healthcare costs, so pay the highest premiums. And nearly all of the individuals with marketplace coverage in that age group, it's about 4.8 million older adults with marketplace coverage right now, will face these most significant premium increases. And the reason for that is because many of them are moderate income who, for the first time, were able to get help with their premiums because of the enhanced premium tax credit. So those are folks who are on the precipice of losing all help with any premiums completely. And to really drive this point home, KFF did some modeling. So an example would be a 59-year-old widow in Jackson, Missouri, who makes $63,000 a year. For 2025, she might have paid $5,300 for a silver marketplace plan. $5,300 is not nothing, but she got the help of the enhanced premium tax credits. Without those tax credits for 2026, she would be looking at premiums of more than $14,000. Wow. For the same plan. And that's just one example, but of the choices that consumers all across the country make, that'd be a quarter of her income in this situation, and really the disproportionate impact on people in that age group.
Yeah. Ms. Stearns, Susan, you talked about how important it is to be able to go back and forth between Medicaid, between the ACA marketplace and employer-sponsored health insurance. And I've been impressed with the fact that in New Hampshire we've seen the number of insured go up for the last 4 years, so the number of uninsured have gone down, and the premium costs have also gone down for the last 5 years, which is really important. But talk a little bit about what would happen if we don't have that ability to go back and forth between the marketplace and employer-sponsored health insurance. You said a little bit about that in your opening remarks, but what do you see happening to people who would no longer be eligible because they couldn't afford to pay?
I think for people with mental illness and for people with substance use disorder, as I said, these are not paths to recovery that are linear. And I know certainly for people with mental illness, like my son and others that I work with, there are times when you are better than others. And frankly, the system we have now may not be perfect, but it actually is working. So I could tell you what I would like to do to fix it, but I won't go there. But the reality is that indeed, if you can, in New Hampshire, relatively easily, if you meet the income requirements, sign up for Medicaid expansion. And it will cover your mental health and or substance use disorder treatment. And then which will hopefully help you do better, so you may very well get employment. But that may be part-time. But then that's the real brilliance, is that you will no longer qualify for Medicaid expansion, but you'll be able to afford health care. I mean, I don't know if people remember, before we had the ACA, we had people who were on Medicaid who were afraid to work because they would lose their access to their mental health treatment, because they would lose their benefits. This is a huge step backwards. And it's frankly one that people like my son and so many other Granite Staters cannot afford. And long-term financially, it's going to cost us all far more. And we're going to lose health care providers.
Well, thank you. That's a really good point. And we should give credit to Senator Hassan, who was able to get the Medicaid expansion done when she was governor. So
yes,
thank you for that.
And thank you. We're going to go to Senator Klobuchar. The only thing, Ms. Keith, I would point out that you are testifying before the Senate, and we think 50 to 64 is younger middle-aged. Senator Klobuchar.
All right, very good. Well, thank you, Senator Warner, Senator Shaheen, for holding this really important and timely spotlight hearing. And I wanted to start with you, Ms. Keith, just because the reason this is so timely is the time is now. December 15th is the date. This is not a January thing or a February thing. This is not, as our Republican colleagues have said, a time for a robust discussion about a plan like you just saw Senator Welch share with all of you. So from the Republicans, could you, Ms. Keith, explain why these enhanced premium tax credits need to be extended right now and why we can't wait until January?
No, absolutely. And the time, in fact, was yesterday, but here we are today doing this important work. So right now, consumers face the first of a few deadlines, but December 15th really is the date that they're finalizing their coverage for January. And so you have more than 22 million Americans grappling with these decisions right now, looking for the certainty that they need to make these critical health decisions. If there is not action taken today, yesterday, to lower healthcare costs, we are going to see 4 million people go uninsured over the next 10 years. We're going to see healthcare providers lose out on vital revenue. We're going to have all of these downstream implications. But right now, consumers are trying to make sense of their lives and make really, really challenging decisions. So it could not be more urgent than it is now.
Ms. Gaspard, do you want to talk about how this could affect the healthcare system as a whole? Of course, it affects the enrollees with their doubling, tripling of their premiums, but how about everything else?
Absolutely. So there's two impacts I'd like to highlight. One is to the broader health insurance risk pool. So we know through history, anytime coverage is made less affordable, a lot of the first people to drop may be people who are on the younger side and feel more able to kind of roll the dice and take a risk with being uninsured. That has the effect of destabilizing the entire health insurance market, and everybody ends up paying higher premiums as a result of that. It's destabilizing. From an actuarial perspective, that's just not how insurance markets work well to keep costs down. The second impact is to our healthcare delivery system. To the extent we expect to see more people going without insurance, that doesn't mean that those people don't have healthcare needs. They're still going to be coming to our hospitals, to our community health centers. And those provider systems will carry more uncompensated care, bad debt. Again, that gets passed on to everyone else. And as you've heard from my fellow panelists, we expect that to mean that many providers cannot continue on. And we're already facing a very fragile environment for our provider systems, certainly in Massachusetts, and I know that's the case across the country.
Thank you. Ms. Winters Castle, I met with one of my small business owners. One employee, she had, employee had cancer, got through it, and now with these premiums, she doesn't know if she can afford it. Could you, and yet she likes the employee, but she's got to balance this. I just think people who work at big companies or people who work for government, they aren't going to be as affected by this as small businesses that don't have the reserves. Could you talk about the trade-offs you may be faced with?
I mean, you know, our discussions, my husband and I, we've been debating, you know, does one of us, we are both very happy with what we do. My job is very meaningful. I've been texting with a client right now whose blood pressures went up and is she going to be induced or not? And, you know, I find it very meaningful. I help mothers meet their breastfeeding goals, which also talk about ways to lower healthcare costs over the lifetime. Also, thanks to the ACA, I'm able to take health insurance for that service. My husband is very, very happy with what he's doing, but we've been saying, like, is one of us going to have to make an even bigger change and find a job that comes with healthcare benefits that we don't particularly want? I've considered going back to nursing school to become a nurse midwife. Now, apparently, I won't qualify for loans because that's no longer a professional degree. I don't really want to be a nurse. I don't want to go to nursing school, but at the end of the day, I can't afford almost $20,000 a year.
Yeah.
My youngest, who was just in here, he has asthma 2 years ago. He had a 4-day stay at the Children's Hospital because he got RSV. I mean, that would have been catastrophic had we not had health insurance.
Thank you. My time's up, but we want to find out the trick from your 99-year-old mother that maybe you can share with us. That's even older than any senator, so that's pretty good. And thank you, Ms. Stearns, for your work in New Hampshire. I'm aware of it, and thank you very much.
Thank you.
Thank you, Senator Klobuchar. We've been joined by Senator Coons and Senator Cortez Masto, but we'll go next to Senator Hassan.
Thanks, Senator Warner. And I won't take long because really most of my questions have been answered. But first of all, to Susan Stearns, I just want a huge thank you. We both share children named Ben. And our Bens have both had similar challenges. And so I'm very grateful to you for your work. But I also am very grateful to you for talking about the difference that the ACA has made, Medicaid expansion and the ACA for people who are seeking addiction treatment or mental health treatment. And just, you know, to amplify the point that Susan made, one of my constituents, Sherry from Lebanon, New Hampshire, was battling addiction, other mental health challenges. They're often co-occurring, as I think probably everybody knows. And her story about getting help through the Medicaid expansion program was a story about getting treatment, but then getting into recovery and her ability to return to work and then to go on to private health insurance, which, of course, through her employer, which, of course, is one of the goals we all have, is for people to be able to get better and get to work. And as Susan indicated, that is a story I have heard over and over again from people who have gotten treatment for substance abuse or mental health or any other chronic health condition on Medicaid expansion and been able to return to the workforce. And I think it is easy, as we're having these discussions, people have been very focused, rightly so, on the challenges of our current healthcare system. It's expensive, it's fragmented, we got work to do, but it's also important to remember where we were before the Affordable Care Act, where people with pre-existing conditions couldn't get treatment, where people were afraid if they were on Medicaid and they did have benefits, they were afraid to go back to work. So I just think as important as it is for us to drill down on the challenges with the ACA and the things we need to do better, it's important to remember what the world without the ACA looked like and how devastating that was. Either you couldn't get treatment at all or you went bankrupt if you did, if you had a pre-existing condition. And I think maybe that, Ms. Keith, I will maybe just ask this one question of you, which really goes to this issue of what happens if we don't have health care coverage for everyone. Because one of the arguments that I hear is somehow that the ACA made healthcare more expensive. And maybe you could comment on the value of having more people covered, or in the optimal world, having everybody covered, people would have to opt out of coverage, let's say. But what is the value in terms of not only healthcare for people who need it, but also in terms of the expense of our healthcare system? Is there a positive value in having more people covered?
There undeniably is, absolutely. And with the enhanced premium tax credits in particular, the Affordable Care Act itself made huge, incredible gains in coverage, as we've discussed. But even the enhanced premium tax credits alone, bringing so many more people into the risk pool, has helped keep premium stable, which is what we're looking for. And so they've held actually steady and below the growth we've seen in the employer market, which is a really, really critical point. And so facing huge coverage losses, we would expect those premiums to go up over time, and the level of disruption that we're seeing here distracts, I think, from the really important points that you have made, that many other senators have made here, of what we're doing about the healthcare system and making some of the improvements that we need. Even the idea that we're talking about going to health savings accounts as a solution to this is not, we're going in the wrong direction. We know consumers want lower costs, better coverage, and less complexity, and it takes us exactly in the wrong direction.
And healthcare demand is generally not an elastic thing, right?
Exactly.
So it's not like a classic supply and demand issue. When your baby has an ear infection at 3 o'clock in the morning, you're not shopping around. And one last point, I guess, just to Senator Warner and my colleagues and to all of you. There has been a lot of bipartisan work in the United States Senate on healthcare costs, and I want whoever's watching this hearing to know that. Unfortunately, a lot of it, which was in an end-of-the-year package a year ago, PBM reform, a bunch of other stuff, it had passed both the House and the Senate, and we were ready to pass it again, and Elon Musk, in one tweet, essentially vetoed it. So we should bring back some of those good bipartisan pieces of work and continue to work on healthcare cost transparency and coverage and bringing down the cost for everybody. But thank you all for being here and for your expertise. And Senator Warner, thank you for holding the hearing.
Well, thank you, Senator Hassan. I would just say this is not I had a decade ago. I think we got to start with universal health care, and then we got to actually focus on bringing down costs, because all we do right now is we argue about expanding coverage, contracting coverage, and yet costs continue to rise. Somebody who's also been a leader on this, who I'm spending a lot of time with on another issue these days, my dear friend, Senator Catherine Cortez Masto.
Thank you. First of all, thank you, every single one of you, for being here and doing what you do. It is so critical now more than ever. So many people are in need of health care. And some don't need it, but they should have just the insurance of it, right? And that's what this is about. And it should be affordable. We should have quality health care. It should be affordable. You should have access to the medicine when you need it. That's what this country is about, right? I would also assume, and maybe I shouldn't, but we also know that it's not perfect. And there are reforms that need to take place. I think we all agree that, listen, if we can improve upon it, and we can also address the fraud, waste, and abuse. Of course, we can do all of that without taking health care away from those who need it. And so, Ms. Bush, let me start with you. The individuals that you're talking to are the people that actually need access to health care, correct? Who are you hearing from? You're not hearing from the fraudsters. You're not hearing from people that are taking advantage of the system. What you're hearing from the people that actually need it.
Yes.
And who are they? Can you describe them for?
They're the clients.
And what do you hear from them? What are they telling you why they need health care, if any?
They need health care to stay alive. You know, they have critical issues, you know. They may have strokes. Some may have heart attacks, you know. So they need that insurance.
Right. And what I hear also back home is there's a lot of working parents who need it.
Oh, yes.
For their children who have a rare disease and they can't afford health care. Is that right?
Yes.
That's right. And so there's so many of those folks out there that's what this is about. And that's what this fight is for. Let me, Ms. Gasteyer, let me ask you this because Massachusetts, like Nevada, has a state-based ACA marketplace. Is there any unique administrative challenge that a state-based marketplace is facing as we delay extending the enhanced premium tax credits, or we don't do it at all?
Yeah, I would say, you know, right now we're in the middle of the most complicated open enrollment period we've ever had to prepare for and execute because of the uncertainty about the future of the enhanced premium tax credits. So we've had to communicate in complex ways with the hundreds of thousands of people that we serve to make sure they understand how federal changes, or inaction in this case, is shaking out in their premium increases. We are ready operationally to effectuate an extension if that does come through, but just that general uncertainty is certainly an administrative and operational challenge. People's lives that depend on marketplace coverage, they're really looking for stability, and so too are the organizations that provide people care, you know, at home or through nonprofits across the board. Americans are just looking to be able to count on their health coverage to be there for them when they need it. It's a very simple ask. And those of us who are on the front lines trying to provide that coverage are looking for that certainty as well.
Yeah, thank you. And then one final question I have for you, Ms. Keith. Recently, two of my colleagues, Senators Crapo and Cassidy, just introduced an ACA reform proposal that replaces the enhanced premium tax credits with a health savings account. Do HSAs actually give people the same immediate relief from high monthly premiums that the enhanced premium tax credits do?
Absolutely not. No. HSAs are in no way a substitute for the enhanced premium tax credits or even comprehensive health insurance that people really and truly need. As mentioned, I think what consumers want is lower costs, less complexity, and better coverage, and HSAs fail on each one of those metrics. It does nothing for premiums to lower premiums. There was an example earlier from Vermont where you can see just how much these premiums would be going up. They incentivize high deductible health plans, so deductibles would get higher, out-of-pocket costs would be greater for consumers, and it would add complexity where consumers are already overwhelmed by all the choices and options that they have to navigate. So HSAs would do nothing about the current premium affordability crisis and, in fact, expose people to much higher out-of-pocket costs.
And let's just say, for example, maybe the proposal was a good idea. It really isn't, but it needs work. Let's say it was. Would it do anything right now to help those people who are falling off the cliff immediately in the next year?
It definitely wouldn't do anything right now. It would need to be administered. I would also add that HSAs are not even new for marketplace plans. This is an option that some people have already, and even for 2025, only 2% of consumers opted for an HSA-eligible marketplace plan. Consumers are not enrolling in these products, and I don't think it's even that surprising why. This is not a population that has cash lying around to put into a tax-preferred savings account to fund out-of-pocket costs. And you see what consumers want is more generous silver and gold coverage. So this is, in many ways, I think, a solution in search of a problem when the real issue right now is the premium affordability crisis that millions of people are facing.
Thank you. Thank you, all of you, for being here.
That's pretty amazing. Only 2% on the HSA signing up. And I'm glad, you know, we've had a number of other colleagues here. We've had all women presenters. Most of the senators who showed up have been women, although Senator Welch was here. I want to turn it over now to a guy who actually does care about health care, my friend Chris Coons from Delaware.
Thank you, Senator Warner. Thank you for helping facilitate this, and thank you to those of you who've dedicated your life to access to quality, affordable health care, for the work you do, and for taking your time to come and testify in front of a group of senators really concerned about what's about to happen to the American people. When we first started raising this issue several months ago, it wasn't right in front of most of the Delawareans I was talking to. They didn't realize how much their health care rates might go up. They didn't realize it was going to affect a very broad range of people. Often folks who are on a health care exchange don't even realize they're on the Affordable Care Act because it's got different names in different states, and it's not something that's been advertised to them. So when my own folks who, like me, get their health care through the exchange realized this is applying to us, they were surprised. And in Delaware, as I've talked to navigators, to healthcare providers, and to people whose healthcare is about to skyrocket, they've gotten more and more alarmed, especially now that they can see it. They can see what the costs will be of having what makes the Affordable Care Act affordable taken away from them. So tomorrow, the Senate is going to vote on whether or not we abandon affordable quality health care for 20 million people. I'm going to be voting, along with every Democrat, to extend the ACA tax credits for 3 years. Republicans have had 15 years to come up with a better plan. President Trump ran twice on making it better and cost less. The Republican caucus still hasn't come together around one plan. They have 3 or 4 plans floating around. And bluntly, none of them are better than an extension. Like Senator Cortez Masto, I agree the ACA is not perfect. There are some things we can and should do to reduce cost increase and to improve coverage. But the proposals I've seen so far from my Republican colleagues don't meet those goals. So if I could, Audrey, since you're the marketplace director for the ACA for the state of Massachusetts, Americans have had almost 40 days to go online and look at their health care plans for next year and see what the prices look like. And I've heard from dozens of Delawareans who've logged on and been shocked to discover that while the rate may go up 20 or 30%, losing the tax credit means it's going to more than double. I just talked to Linda from Delaware Healthcare Navigator at one of our community health centers who helps others understand and enroll in coverage. And she shared that not only are people shocked about their premiums, they're canceling insurance rather than re-enrolling. They've decided they just can't afford it anymore. And more broadly, that means the pool of who is going to be insured is getting smaller, sicker, older, and this is going to impact all of us and all of our costs. So you run a state ACA marketplace. What trends have you noticed during open enrollment? And what do you think will happen if Republicans block our bill tomorrow to extend what makes health care affordable through the ACA?
So far this open enrollment, we've seen exactly what we worried about all year as we saw this crisis looming in the distance. We are getting calls from people who are distressed, are shocked, cannot believe what they're looking at. We have seen over 10,000 people already terminate their coverage for 2026. That is over double what we saw at this time last open enrollment. So to the extent that that's an early leading indicator of what is to come through the rest of open enrollment, and I think about a state like Massachusetts that has a lot of additional supports in place, has a very high level of its population already covered. If that's what we're seeing this early in Massachusetts, that really makes me shudder to think about what's going to be happening in the other 49 states. So that is what we're seeing. When you ask what will happen if this does not go through, we're going to expect people to drop coverage, or we're going to expect people, the ones that do stay in, who are probably sicker and older and are the ones that can least afford to be without care, will stay in, but they'll make great sacrifices in order to do so. They'll cut back on grocery costs. They'll struggle to pay rent. They'll take on other debt. So that will be concerning for those individuals. And then overall, as we've talked about, the entire system will bear the costs of more people being uninsured. That will be passed on to other premium payers because we'll all have to pick up the tab for hospitals and community health centers and others who will have more bad debt and uncompensated care. So the ripple effects will be far-reaching, and none of them are good.
But Audrey, thank you. if I understand properly, that also will shift care. So those who don't have insurance will go to the hospital or seek medical care later when they're sicker, when it's less preventable and more expensive.
Exactly.
And in my state, ER wait times are already among the worst in the country. As I've tried to help connect with Delawareans and explain to them, even if you're not on the ACA, if you got your health care through your employer and you have a great health care plan, why should you care? You're still going to the same ER.
Right.
And those wait times are going to get longer, and the people waiting are going to get sicker. Kathleen, if I could, I recently talked to a small business owner in Delaware, someone who, like you, is both intimately engaged with healthcare because she has survived a bout of cancer and runs a family small business with her husband. They've been in business together 30 years. And when I talked to her, this is Jan from Newark, Delaware, she first said she wouldn't have survived that cancer without the ACA, without that coverage. She would have been bankrupted, and she wouldn't have sought preventive coverage early enough. Now that she's looking at dramatic increases in her ACA coverage cost, she and her husband are having really hard conversations about closing their business in order to go get health insurance through, a larger employer rather than through the ACA. How's the ACA helped you as a small business owner, and what do you think's at stake going forward?
I appreciate you highlighting that story because I think that people in our circumstance are not widely recognized in the discussion. We've been having similar conversations. My husband runs his own business, I run my own business, and maybe one of us has to close down and sacrifice. Running my own business allowed me to do this today. I was able to shift all my appointments and come up here. It allows us to be present for our children and to do meaningful work that we find we're passionate about. We may have to shift plans. And I think the hardest thing about this is everybody keeps talking about the December 15th deadline. The deadline was really November 1st.
Right.
We've already passed it. And people keep asking me, well, what are you going to do? And I'm like, I don't know, because I don't know what y'all are going to do. I can't make a decision until I know what the options actually are. And I just think it's unconscionable, the cruelty involved in postponing and postponing and postponing and procrastinating this when the outcome is so dire. And so am I going to try to go to nursing school? I don't know. Am I going to keep my business and serve the families in my local community? I would love to. I don't know.
Well, Kathleen, I can tell you what we're going to do. Democrats are going to keep working and fighting and voting to sustain the affordability of the ACA, to sustain access to health care coverage. And we might not succeed tomorrow because Republicans might block us on the floor, but we're going to keep carrying that forward until we get it done, either through election or through passing legislation. Kendra, if I might, just one last question before we turn to Senator Durbin. As a professional caregiver, as an SEIU member caregiver, as someone who works both at hospitals and at homes, you see every day how critical access to quality, affordable health care is. Why is the ACA important to you and your family and to the people you care for? And what will happen if these credits expire?
It'll be very devastating. Working every day, I try to keep my health in part because I can see myself going, if I go into there and have a stroke, what's going to happen to me? And I can't take care of my clients anymore because I'm taking care of them to get better. And it's very devastating for me right now.
Kendra, Audrey, Kathleen, thank you for your testimony. And Susan, thank you. Katie, thank you for being a part of this. We've got a big fight on our hands, and it's important to have your voices here and to have your model and your example. Thank you, Senator Warner.
And he did take that extra 3 minutes and ask the question I was going to ask you, Kathleen. Let the record show. But we've been joined by, again, somebody who's been at the front lines of this fight literally for decades. And he will be the last questioner because I think we're supposed to wrap up around 2:15. And that is my good friend, Senator Dick Durbin, the minority whip, the great senator from Illinois.
Thanks, Senator Warner, and thanks for coming. Sorry I got here a few minutes after your testimony, but I've reviewed it and understand the challenges that each of you have faced. My experience, having been around the House and the Senate for a long time, is that many members are motivated and inspired by their own personal experience. This is one for me. I was a student at Georgetown Law School when I got married. God sent us a baby right away. And she was a beautiful little girl with a serious medical condition. And I had no health insurance, law student. And my wife wasn't working, and I was trying to figure out what's next. What was next was to go to the old children's hospital here in Washington and to sit in what they call the charity ward for people who couldn't afford to pay and didn't have any insurance, and to wait to see if a doctor ultimately would walk through the door and say my daughter's name. And I would get to meet that doctor and try to pray to God that he or she was competent to save my little girl's life. I never felt any less adequate than that moment as a husband and a father, not having health insurance. I remember Children's Hospital said, well, we think you have two options. One of the options is you can go on welfare. And I said, it doesn't sound right for a law student to go on welfare. What's the other option? Declare bankruptcy. I said, I haven't even taken that course in law school, so I'm not sure I want to do that. What happened was I paid them back over a period of 10 years. But I'll never forget that moment. And that it's inspired me to be part of this conversation from a personal perspective for a long, long time. The second thing I'll mention to you, and it again relates to personal experience, and the issue of mental health. The debate on the Senate floor for a long, long time was led by two senators, Paul Wellstone of Minnesota, whose brother had a mental illness, and Pete Domenici, Republican conservative of New Mexico, who had a child with a mental condition. And they were trying to get something into the law which was considered revolutionary, that health insurance policies would basically cover mental illness and addiction. That was considered to be radical thinking, socialism or something, whatever the heck they wanted to call it. But it made so much sense that we included it, and thank God we did. As we face the opioid crisis, there were many lives saved by the fact that there's paid-for counseling available through the health insurance policies of after ACA, and you've lived that experience personally. Let me ask you if you have the same vision of this that I do. There was a time that if you said in the world of addiction that somebody had died, overdosed, your best guess was, well, I'm guessing it was a male, African-American male, between the ages of 25 and 35, poor person living on the streets, right? You used to be right most of the time.
That was the stereotype.
That was the stereotype. And then came opioids. And they said, no, the overdose occurred from a white cheerleader in a suburban high school who was taking opioids. I mean, the whole conversation changed. It was no longer just say no. It was an addiction. It was a disease. It was something to be treated. And that changed because of this conversation. Tell me a little bit about you've already spoken about your experience with your family with this.
So I thank you for the question. My father lived with an alcohol use disorder, and so it is something that is an issue in my family for generations. In New Hampshire, I have lost count of how many people I know who have buried loved ones after an overdose death in recent years. And we have worked really hard as a state in order to help people have access to the treatment that they need. But frankly, without the ACA, including Medicaid expansion and the subsidies for the marketplace plans, we would not have turned the tide as we seemingly have at this point. Lives are literally being saved. We can't afford financially to have these tax credits expire. We will lose providers. They will have to close up shop. We won't have access to that care. People will not be able to afford their coverage. And frankly, the costs will be unbearable in terms of what it will do to families like mine and communities. The heartbreak will kill many people after they lose their loved ones. So I cannot emphasize more how critical it is for these, for us to move forward. The reality is we have more work to do in order to improve our healthcare system. And allowing us to backslide by letting these enhanced premium tax credits expire. We don't have time for that.
No. This morning, this afternoon, there was a statement made on the floor by the leadership, the Republican leadership and Democratic leadership. And speaking for the Republican leadership was their whip, who is a medical doctor, an orthopedic surgeon from Wyoming. And he was talking about all of the shortcomings and flaws he finds in the Affordable Care Act. And he went through a long list, and I read the same thing in the Wall Street Journal editorial on Monday, where they went through a list too. And he was rationalizing voting no on the extension of these tax credits. My challenge to him, as I spoke afterwards, was let's get together and work on all of the elements you mentioned. If they have any merit, let's work on a bipartisan basis and fix it. But in the meantime, the waitress at Lou Mitchell's restaurant in Chicago, who just is going to see her premiums double on January 1st, I want her to keep her health insurance while we're doing what we're supposed to do, debating and legislating and improving these programs. And that's what that would really trouble me in terms of moving forward with all these people losing their coverage. In mental illness, I can't imagine what the next week, next month will be like for them.
May I?
Sure.
I think we all saw the toll that the COVID pandemic took on the mental health, particularly of our young people. And the reality is our young people are watching. They have recognized how important mental health is. And indeed, they are going to remember this moment in time. And whether all of us, the adults in the room, right, tried to protect their mental health care, recognizing that, we have started to recover from that impact, but we still have a long way to go.
The last point I want to make, Mr. Chairman, is this. There was a time when mental illness was viewed as a curse and was viewed as something you just didn't talk about. My mother was treated during most of her life. This was a deep, dark family secret because you just didn't let anybody know, not even relatives, if you could avoid it. And then there was this big change, and I really point to the Iraqi war. Those veterans came back with PTSD and said, help me. I don't want to have to face this the rest of my life. Help me. And the conversation went from just say no to dealing with mental illness and addiction as diseases that could be treated and treated successfully. How can we go backwards now? How can we say to these people who need the treatment, no, we're just not going to care for you? I mean, that to me would be a terrible commentary on where we are as a nation. I hope we're better than that. If we don't get the votes tomorrow, the fight continues with more intensity. Thank you, Mr. Chairman.
Thank you, Richard. And I just, today was to hear from you guys, and you've all, I think, very eloquently made the point that this is not only policy, this is life. And I know, I've got a personal story. Everybody's got a personal story where that I've been able to afford it, but I mean, I couldn't imagine if I was faced these issues with two of my three kids. And I just, the thing that kind of, and Dick and I both try to be bipartisan. I just wish that some of my Republican friends would have been sitting here and listening to you and try to say, well, gosh, if we give you a check for $1,500 once a year, that's going to solve this whole problem. It just is not. I want to close with just one thanking you all, but also, you always keep hope alive. But Kathleen, I wouldn't bet the farm that we're going to get this passed tomorrow.
Yeah.
And you're going to have incredible hard choices. And the fact that you and your husband have built these businesses, we thought we were for small business and entrepreneurship, and this could snuff that out for you. But we're going to stay at it. And thank you for coming. Thank you for sharing. And thank you for being in the fight. I will close with what Richard said. I believe in my core, I wouldn't be still doing this stuff, that the American people are better and more empathetic and sympathetic and understanding than I think what will be the results on the floor tomorrow. And, at the end of the day, There was one team that was trying to say, we want to get this fixed, imperfect as it is, but at least not have this cliff, and one will not. And if we don't get it done in policy measures, I just implore, particularly as you say about the young people, you got a right to weigh in. And that right to weigh in is at the ballot box. And we all have to take this memory of what happens or not happens tomorrow and carry it with us. So thank you all. Thank you for your presentations, and thank you for all the young people, particularly in the back room listening. I think we're done. Thank you.
Thank you.